this lecture, we will cover the host and microorganism interactions. To start off with, we do have some basic terminology. So be sure that you go over and review this terminology just to be familiar with it and to ensure that you understand it for this lecture. Now, within microbiology, we do kind of have to understand the infectious process. And so we did cover this in depth within immunology. So we're not going to spend a whole lot of time on the infectious process, but we are going to kind of recap it just to make sure that you are familiar with it. Now, we do understand that the body does contain many normal microbiota or normal flora. And what this is bacteria that will actually colonize various sites within the human body. And they don't actually cause any sort of disease state when they're in a healthy host. The sites in which we find this normal flora are going to include sites like the skin, the mouth and oral cavity, the nasopharynx, as well as the respiratory tract, GI tract, and the genital, as well as the urinary tract. Now, there are still sites within the body that do not contain any sort of normal flora, so if you find any organisms within these sites, then it's either going to be some sort of contaminant or the contaminant just in the collection process, or it's an actual infection or a potential infection. So these sites are going to include within fluids would be blood, so there should be no organisms circulating within the blood, the spinal fluid, joint fluid, or within the urine. Now you can get a urine specimen that's got bacteria in it that's just cross-contamination from just normal flora. But typically if you were to get it just directly from the bladder, then it's going to be sterile. It's not going to have any sort of bacteria in it. As far as internal organs, sites that do not have any sort of normal flora is going to be the brain. Again, you've got that CSF that's coating the brain, so you would expect it as well to not have any sort of flora. The liver is going to be part of cleansing the blood as well as bone, which is going to be responsible for making those cells, your kidneys, and your muscles. So none of these sites are going to have bacteria residing within them. Now, colonization. So colonization is when you have the growth of the microorganism on the host and it's not actually causing any sort of a damage. So some of your sites are going to include your internal organs. So this is going to be your skin. Again, this is going to be normal flora that we expect to colonize these sites. Sites of internal colonization, of course, your mucous membranes, and this is going to be of the gastrointestinal tract, respiratory, as well as your genital tract, so your urinary and your sexual organs. The colonization can be eliminated by the host, or it can actually cause an infection, or it can be symbiotic. When you've got a pathogen, this is going to be a microorganism that's able to actually cause the infection. And so when you have colonization, it's actually going to depend on several things, whether or not it is a pathogen to that site. So just having colonization on the skin of normal flora is not necessarily going to cause an infection. However, if it's introduced into the deeper layers, it could potentially cause an infection because it would be a pathogen in those deeper layers. It's also going to depend on what the body does based off the various virulence factors that that particular organism has, and this is the degree to which it is actually pathogenic. And so we will learn a little bit more about the various virulence factors that each of the individual organisms have. The infectious dose. So this is going to be the minimum amount of pathogenic bacteria that will actually need to be introduced to the host before the host will actually develop any sort of clinical signs or symptoms. And so all of these can kind of come into play, as well as many of the other different factors that are involved, as far as the host immune response, what the person does with it once it's presented, the route in which it's presented. So there are a lot of factors that can be involved as far as whether or not colonization can take place. Now, just because there is colonization doesn't mean that it's going to be an infection, because we do have colonization of normal flora. So here we have a diagram that kind of demonstrates how an infection can take place, or the cycle of an infection, and how an organism is able to be pathogenic. So first you're going to have the particular pathogen. So this would be the particular microorganism. Um, Now, if this organism is surviving anywhere on a surface or anything like that, then it does have the potential to cause an infection. So what you've actually got is a place that that pathogen is living. So you have some sort of reservoir or source where that pathogen is at. Now, let's just say a few examples. It could be living off of the chicken that you put on your kitchen counter and you expose it to other food that you're preparing. It could be that cough of the child behind you in the grocery store that just sneezed on you while you were waiting in line. It could be um, in an animal bite. It could be anywhere. So basically, wherever that source of that pathogen is going to be part of that cycle as far as how it's introduced. Now, then you have step 3, where it's actually transmitted to a susceptible host. So the environment's got to be right. It's got to be transmitted. The host is got to have some sort of breach in that immune system that allows it to enter. So you have some sort of portal of entry into the susceptible host, and then those various portals of entry can be anywhere like skin, respiratory tract, GI tract, um, the urinary tract. It could be pretty much anywhere in the body, and there's various reasons why it could actually be introduced. But let's just say from the respiratory tract, you get some sort of exposure from, maybe you're in the grocery store and you um, have someone that sneezes in your vicinity, and you have those respiratory droplets that are transmitted or sent through the air that are going to transmit whatever that viral particle is. Or let's just say that someone picked up some chicken out of the grocery store and it had chicken juice on it, and they laid it in the seat of the buggy, and then you touch that seat of the buggy and you get that salmonella on your hands, and um, you scratch your face, or you know whatever, you touch something and you put that in your mouth. Well, that's your portal of entry. Now, once it is in the body and it has infected the host, now if it causes infection or the host fights it off or whatever, then your next portal of exit would be, let's just say that you do get salmonella from that chicken exposure in the grocery store. Your portal of exit, we all know what that is. You're sick, you're nauseated, throwing up, diarrhea, you get it on your hands, whatever, and then you transmit that to somebody else. Or let's just say you got a cold and you sneeze and you transmit that to somebody else. Well, this whole cycle starts back over. So you can kind of see just how the cycle of infection takes place. Now, some of the various routes of infection can be directly transmitted or indirectly transmitted. Of course, the reservoir of infection is going to refer to the origin of the etiological agent and its location. So it's basically wherever that organism is living and residing, that it's able to stay alive and then be transmitted by some means. So with our direct transmission or our direct contact, it can kind of be um, subdivided up into how it's transmitted. So you can have a horizontal transmittance or a vertical. And so with vertical, it's going to be congenital. So it's going to kind of be passed down from mother to fetus or mother to newborn. With your infections that are on a horizontal level, these are going to be like human to human, or um, some sort of like respiratory droplets, sexual contact, hand to hand contact. So that's going to be your direct transmission. Now, when you have an indirect transmission, that can happen several ways. So when you're directly getting it from someone. indirectly you're getting it from something. So it could be a fomite, which could be like some sort of inanimate object. So like a contaminated cell phone, kitchen counters, eating and drinking after someone who's infected, using those various utensils, clothing, money, contaminated medical instruments. So anything that you basically can touch, an inanimate object that is contaminated. You can also have transmission through a vector. So you can have various insects and things like that that can transmit. So we know about things like Lyme, malaria. And then you can also have an animal transmit it. So there are different animals and animal bites that can cause various infections. You can have things like airborne or your food, your water, those things that are contaminated to cause infection. So with food, we know that you can have various infections that can be spread just through contaminated food. You see a lot of recalls out there for things like listeria. So just know that there are several different routes in which you can actually get an infection. Now, there are two types of main infections that we kind of refer to, a primary and opportunistic. Now, with your primary pathogens, these are ones that cause the disease in the host regardless of the host immune status or normal flora. So something that you could think about like this would be salmonella. Anybody could probably eat salmonella. I don't know why you'd want to, but they're going to get sick. So that would be like a true pathogen. Then you have things that are opportunistic. So these are diseases that can occur when the host has some sort of pre-existing condition that's going to increase their susceptibility. And this could be something like a damage to a protective barrier, immunodeficiencies, um, loss of normal flora. So like when you take a lot of antibiotic, let's just say you've got a urinary tract infection, you take a lot of antibiotic, especially with women, then you start killing off that normal vaginal flora, and then that results in an overgrowth of yeast. Um, you could have someone who's like neonatal or elderly and they don't have those antibodies or that immune system that's not as robust as it should be. Things like chemotherapy, immunosuppressive types of medications, all this can kind of weaken that immune system, weaken those barriers, and then allow the patient to be more prone to an infection that they wouldn't typically get. Now, you do have immunosuppressive conditions in which the host immune system is unable to actually effectively battle those microorganisms that we would typically consider normal flora for the general population. But in that immunocompromised patient, it can actually lead to an infection. So this could be something like where, Staphylococcus may be normal flora on the skin, but for some reason, um, it's causing an infection within this patient. So that could be an example. Now, an iatrogenic infection is due to some sort of medical treatment or intervention that has allowed that infection to take place. So an example of this would be getting a UTI infection because you cath someone. So they didn't have the infection before, but the process was done to try to prevent that infection when doing that catheterization, but that catheter entering in introduced some flora that maybe was normal flora, or maybe it wasn't normal flora, but it introduced that flora to that UTI tract, and then the infection takes place. Or let's just say chemotherapy, it depletes the patient's immune system. It targets those various cells that reproduce rapidly, and then it makes that patient more susceptible to infection. So anyway, just kind of understand that there are kind of differences between the infections. One that would be considered a true infection versus one that's more opportunistic, and it's usually going to be opportunistic due to the patient's immunosuppressive type status. All right, so the types of infections that you can have would include something like a localized infection versus a systemic infection. With your localized infections, these are going to be basically contained to one single area of the body. So we think of something like strep throat. It's just in within the throat area, around the tonsil area, that infection is taking place. With your systemic infections, so these are going to be ones that have spread outside of the original site or focus, and they've come to or disseminated into a deeper organ or tissue or another body site. So with that same example with strep throat, if it becomes systemic, let's just say that it has spread throughout the body, and maybe now that it's affecting the heart, or there's a infection within the blood. So that will be systemic. It's spread out from its original site and has gone to other areas of the body. Now, an infection can be primary or secondary. If it's primary, this happens in an otherwise healthy host without any sort of existing infectious disease that's present. Or if it's secondary, it can happen within a host who has already been weakened by some sort of primary infection, or they may be, the process or the disease process may be more severe because there's more damage that's being caused by that particular pathogen. And so what can happen is you can actually see superinfections take place. And so these develop when you've got some organisms that are growing that have developed resistance to antibiotics. So there's been some sort of overuse of antibiotics. Those organisms have developed resistance, and now they're unable to be contained or controlled. You can also have infections that are endogenous. So these are microorganisms that originate from the host normal flora. So they're normal flora, but they've been reintroduced into another site. So let's just say, for example, E. coli being normal flora in the GI tract, but now it's been introduced into the urinary tract, and so it has caused an infection. An exogenous infection is going to be from a microorganism that originates from an external source. So it's going to be a particular bacteria that it's going to be introduced from an outside source. For example, salmonella being introduced because it's contaminated on your chicken, and then now you've got an infection. You can also have different types of infections that are going to be known as a healthcare associated infection. So this is going to be an infection that has happened as a result of getting treatment for another condition. In the past, we've called these nosocomial types of infections. So these are infections that you wouldn't have gotten unless you were exposed to it due to a particular health procedure. So for example, you go to the doctor's office, and for whatever reason they need a cath urine specimen, and then by doing that cath procedure it introduced bacteria, and now you have a UTI. Or maybe you had a surgical wound that you went to the hospital for surgery, and then that wound got exposed to some kind of bacteria while you were actually in that healthcare setting. You can also have community-acquired infections. So these are infections that happen outside of the healthcare setting. So you basically have been exposed through your normal environment. And so we think of like our just normal seasonal illnesses like flu and various gastrointestinal infections or viruses that cause a stomach bug. These will be community acquired. You just acquire it from being exposed outside in your normal environment. And you can also have infections that happen as a result of some sort of medical treatment or prevention. So for example, chemotherapy, depleting the immune system, allowing the patient to be exposed to bacteria or get infections that they normally wouldn't get if their immune system was functioning properly. Now, as we learned in immunology, the body does have lots of things that play into the immune system or the immune process. First, we're just going to kind of refresh what innate or natural immunity is. And basically, this is your non-specific inborn type of defense system. It's going to include things like your skin, the cilia, within the lungs, various secretions like mucus, the lysozymes, the IgA, the saliva, the acidic pH of the stomach and the urine, various mechanisms throughout the GI tract, the body's ability um, to produce a fever and have that inflammatory immune response, the body's ability to make those cells that do the phagocytosis. So all of these are still part of that system. So if anything is breached, then obviously that's going to create an environment where um, an infection or infectious organism can start to grow and multiply and replicate and actually live. So um, hopefully the immune system stops that, but if not, then hopefully you've got some other things that can kind of come into play. For example, that inflammatory response. So this is your second line of innate immunity. So you'll have that inflammation that takes place, those changes that happen within the tissue, where you have all of that response that's happening because of that injury. You're going to have that increased vascular permeability. You're going to have that increased blood flow to that area. You're going to have things come in like complement, interferon, antibodies that are all going to be released to kind of stimulate this whole inflammatory process. You also will have phagocytosis that will take place to try to contain and fight whatever microorganism that it is. So you got the various cells that are going to participate in that, as well as that whole process of phagocytosis of trying to engulf and ingest and kill that particular microorganism. Now, your acquired and adaptive immunity. Now, that's going to include your humoral immunity as well as your cell-mediated immunity. So it's going to involve those antigens and antibody responses. So if you look at this little diagram here with your adaptive immunity, it can be artificial or it can be natural. So with your artificial, of course, you know that you can get that through your vaccines. If it's natural, then you're going to get that from actually being exposed to whatever it is and create that immunity yourself, or it could be passive, that it's come through maternal for maternal transfer, so the mother antibodies being passed to the infant. So you've got all of this process that's going to take place in that immunity that's going to respond to any kind of exposure to an infectious organism. Now, we did cover a lot about the immunity and immunology, so I'm not going to regurgitate all of that. But a lot of your organisms are able to evade the immune system simply because of the virulence factors that they have. Now, we will talk about each organism individually once we start talking about them, but for now, just understand a little bit about how this whole virulence factor takes place. So the organism itself can have a variety of features that allows it to not be killed by the immune system, or to allow it to actually invade the host and actually, set up camp and start colonizing. And it can do that by a variety of mechanisms, one being attachment. So this can happen via any sort of fili or adhesion, adherence proteins, biofilms, anything like that that helps it to actually attach to that cell. You can also have invasion, and this is done via various enzymes that will actually destroy the host cells and tissues. And so these will actually start that process that allows that organism to infect that tissue and actually live there and start breaking it down, so it'll start releasing some of those enzymes. That organism can have a capsule. And so that capsule is actually a polysaccharide capsule that prevents it from being phagocytized. Those organisms can produce toxins, and so these are biochemically active materials that are released by that organism that will have some sort of biological effect on the host. Now that can be divided into two different categories. You can have endotoxins or exotoxins. So the endotoxins, these are lipopolysaccharide. They're generally going to be associated with the gram-negative cell wall, but what happens here is you actually have these toxins that are within that particular organisms that are released once that organism is destroyed and that cell wall is destroyed. You can also have those exotoxins. These are actually secreted by gram-positive and gram-negative bacteria, but the difference between these secretions are that it's actually coming from a live organism. This organism cell wall is still intact, it's still living, and it's releasing these various toxins that have a variety of different functions. Now, there are various tests that we can do in the laboratory that are going to be indicators that there is some sort of infectious process that's going on. That's going to include an increase in white blood cell count. Now, we can kind of get an idea of what the particular infection might be based off of the particular cells that are increased. So if we have an elevation in neutrophils, this is usually going to indicate that there's a bacterial infection taking place, whereas if there's an increase in lymphocytes, this is usually going to indicate that there is a viral infection that's taking place. You can also see an increase in your sedimentation rate if there's any sort of infection and inflammatory process, but also know that there are other things that can increase this. Same with C-reactive protein. You're going to see that increased with your infectious or inflammatory processes, so you can have other disease states that can cause this to be increased. We can also see that a patient may have an infection based off of various molecular testing, phenotypical type of testing, direct antigen testing, or looking for a specific antibody to be present. So for example, those mononuclear antibody tests, looking to see if a patient has an Epstein-Barr virus infection. That would be a type of test that we would get to be positive, or we test and see that it's positive, and that would indicate that there is an infectious process going on.